Hey everyone, I'm Dr. Sanansari, a gynecologist. Welcome back to my channel. If you're preparing for part 3, you're probably aware that this is not just another exam. It's a test of your clinical reasoning, communication, and how safely you handle clinical scenarios. In this video, I'll share how to approach the exam, the preparation plan, the important resources, and tips for success. So if you want a structured preparation strategy that works, watch till the end. Now coming to the exam domains. So the exam candidates are being assessed on 5 key domains. Number 1 is patient safety. For example, checking the patient name and age in the beginning, asking for drug allergies, assessing the patient's high risk factors, and ensuring safe clinical practices. Number 2 is communication with patients and relatives, like building rapport, explaining conditions and treatments in language that patient can understand. Number 3 is communication with colleague, like involvement of multidisciplinary team, handovers in post-op ward rounds. Number 4 is information gathering. That is asking the right question, eliciting relevant history and understanding the patient's concern. Number 5 is applied clinical knowledge. That is using the evidence-based medicine and guidelines to provide the best management. Every station assesses a combination of these domains, so it's important to structure your preparation around them. Now coming to the preparation time. It took me around 5 to 6 months time, but it varies. Like if you've recently passed part 2 exam, you're already thorough with all the guidelines, so you'll require less time. The initial 3 to 4 months time should be dedicated to understanding the exam pattern, gathering all the study material and practicing. To understand the exam pattern, you can go through the OSCE sample videos to see how consultations are being structured. Now to compile all the study material, make short notes of all the important topics in each module. Like if it's an early pregnancy module, the important topics are missed abortion, ectopic pregnancy, molar pregnancy. So make short notes that will help you in the revision. Read all the important guidelines that you have done in part 2, green top, NICE, recent talks and patient information leaflets. Find a study partner or join study groups to practice. Remember, doing alone won't help. While practicing, focus on counseling scenarios, emergencies, and difficult conversations. Record yourself and get feedback on tone, clarity, and empathy. The last 2 months should be dedicated to revision and mock courses. So practice all the important sessions with your study partner, attend mock courses to experience timed practice, and take examiner feedback. Polish your skills in data interpretation like CTGs, blood tests, and ultrasound imaging. Now coming to mastering the communication skills. With patient and relatives, always start by introducing yourself and explain your role. For example, if you're sitting in the antenatal clinic, there is an antenatal patient 20 weeks pregnant who came with the level 2 ultrasound report to discuss. Just say by introducing yourself, "Hi, I'm Dr. Sanansari, one of the doctors in antenatal clinic today. May I confirm your name and age, please? How would you like me to call you?"
Hi, you can call me Annie.
So Annie, I have gathered from your notes that you recently did an ultrasound. You're 20 weeks into your pregnancy and you're here to discuss regarding the report. Am I correct?
Yes, doctor, it's correct.
Annie, if you don't mind, can I ask you a few quick questions to know more about you and then we can discuss the plan? So always start by introducing yourself, then explain your role and address the patient's concern. Use simple non-medical language. Avoid jargons. Like instead of using cervix, use the word mouth of the womb, and likewise. Acknowledge their feelings. For example, if the patient is concerned, you can help them by saying, "I understand your concern. We as a team of doctors are there to help you out." Now communicating with the colleagues. Be structured in handovers. Use SBAR tool, situation, background, assessment, recommendation. Show you can work in a team and seek senior help whenever required. Practice like this daily so that it imbibes in you. On your exam day, arrive early, stay calm, use the 2 minutes reading time wisely. For example, always write the patient's name and age on the top to avoid saying wrong names. If you feel stuck anywhere, summarize what you know and move forward confidently. Remember, examiners are not looking for perfection. They want a safe, professional, and approachable doctor. MRCOG Part 3 can feel challenging, but with structured preparation and consistent practice, you can absolutely clear it in your first attempt. If you need help with any of the topic, let me know in the comments. Thank you.